Hello, I'm Dr. Halder. Today I'll speak on epilepsy. It's a kind of problem, we see in many people. Prevalence is almost 1 in 100 people. That means around 10 people are there in a locality where there are 1,000 population. So it's that prevalent. So it need to be, everybody should know what is epilepsy and what we should do. Now people almost know that it's a kind of problem. It arises from the brain. Today what I'll tell you is, while in clinic seeing patients, telling patient and patient's relatives that you or your child or your relation is suffering from epilepsy, there are not many questions that comes. They ask me. So I wanted to assemble all the questions and answer to that. Today I'll mention all the questions and I'll give answer to those questions also. See, the commonest question that comes from patients, patient party or patient gets surprised when I say you or your patient is suffering from epilepsy. So they want to know what is it. Now it's there in internet, it's there in books, our leaflets, in our chamber outside. It's also in a printed manner or in boards we have mentioned what is epilepsy. So it has become a little clear to everybody that some abnormal electrical discharge which comes from the brain that causes a epileptic fit and attack, and patient also becomes okay after some time. Many times there are problems, so that one need to know. Continuously somebody getting fit is a medical emergency, patient may even die, so they need special care. So now people know what is epilepsy, but people say when they come to know that they have epilepsy, first question comes, doctor, is it curable? Answer is yes, it's curable, it's manageable. You see, curable and manageable, these two are different words. Think of hypertension or diabetes. These are curable or these are manageable. If you continue medicines, diabetes and hypertension will be controlled. The disease is controlled. You can't stop the medicine. As soon as you stop medicine for diabetes or hypertension, the pressure is going to rise. The patient may go into a stroke. Sugar will be very high, can land up with problems. But in epilepsy, fits are controlled. Most of the fits are controlled, and not that medicine is to be taken throughout life. It may be reduced, depends upon what kind of epilepsy this is. Almost 70% patients, we just can withdraw medicine after some time. But in some patients, they need more medicines, and there will be few percentage of patients where there will be recurrence of fits, or fits are not controlled. Those are called intractable epilepsies. They need special attentions, high dose medicines, sometimes not controlled, sometimes we send them for surgery. That's a very few percent of patients. So why you think that your patient is suffering from a kind of epilepsy which is not treatable? Think of the majority, okay? So it's treatable, it's curable. And then the question comes, doctor, there is nobody having epilepsy, how can my child have fits? He can have epilepsy or she can have epilepsy? Simple answer is, epilepsy is not a familial problem. It's not that the person who is getting epilepsy, he inherits or she has inherited it from his or her parents. It's like other disease. There are family clustering, means two persons having fits in the same family, that can also happen. That doesn't mean that it's a familial problem. Okay, so this also should be clear to everybody's mind, that somebody is having epilepsy, it's not transmitted to any contacts or even to offsprings or children. This is very sad to say. In some families we have noted, if somebody is having epilepsy or fits, they are separated from the family. Especially this happens with ladies. This is very sad. Now our society needs this kind of educations, that it's not transmissible disease. And then the question comes, doctor, how long medicine is to be taken? I say, yes, it's not throughout life. I already have answered. It's to be taken for a long time. It's unlike other disease. Commonly we give for 3 years and then gradually we try to withdraw medicines if controlled during those time. If uncontrolled, then the measure is different. And if controlled, we withdraw medicine as C, and most of the patients, they do improve. And the question comes, doctor, my son or my daughter or my patient have to take epilepsy medicines for that long time. So can there be any side effects? Simple answer is, see, there is no medicine in this art without any side effect. Even vitamins have got side effects. So always forget about side effects, think of effects. Okay? Any patient can have allergy to the medicines, allergic reactions. Anyone can have some liver problem or gastrointestinal problem or hair fall, something like that. Don't worry. If that thing comes or any hints you notice, don't stop medicine. Rush to your doctor immediately. He or she will immediately take care of your problem. Either you will try to counter the problem with another medicine, or he or she will reduce the dose of medicine so that your the burden of the problem is less, or he may or she may change the medicine. There are other medicines. So don't think that medicine is without any side effects. All medicines have got side effects, but don't think of side effects, think of effects. So that's the simple way. And the question after that comes, doctor, what are the limitations for life? Can my child study, or we should stop going my child to school? Simple answer is, should be normal. Their life should be normal. They can play, any play. Once fits are controlled, they can go for outdoor play. With some limitations, I will come to that. And then the question comes, if some lady is having epilepsy, she will ask, doctor, can I go for cooking? See, the simple answer is, working with fire or any sharp instrument is restricted, because even if somebody is on medicine, can have a fit, and there is no warning most of the time. So if while cooking or using a sharp instrument somebody gets a fit, one can burn or injure. So it should be avoided. Nowadays there are ways, you don't use burners, you can avoid using flame or any heater kind of thing. You have induction cookers, it's the safest one. So a lady can cook in induction cooker with some care, because he or she can fall if gets fit into hot water. So that has to be done. And once fits are controlled, we say if fits are controlled with medicine for at least 3 to 6 months, the risk becomes less, and that time he or she can keep working with anything. So life should be normal. Gradually it becomes normal. So question comes whether my child's or my patient's intelligence is going to be affected with medicines. Simple answer is no. Yes, obviously there are some medicines which can lead to some drowsiness only, not intelligence. In fact, there are some medicines like lamotrigine kind of medicine. We came to know that it's in fact improves intelligence to some extent. Some people did study and say, okay, forget about that, forget about side effects, please continue medicines. And the question comes, if we take medicine still we get fit or my child gets fit, or my neighbor gets fit, what should I do? This is again, everybody should know. Even the people in the street should know this answer, not you or me. Because your patient, the patient with whom you have come, may not be with you when getting fit. This, he or she can throw fit when in the market. So this is, whole community should know this thing, that if somebody gets a fit or throwing limbs like this, please first don't rush and stop him from doing convulsions. Don't hold him. Don't hold him or hold her throwing fits, because that in fact can injure him or her. She can, her muscles or his muscles can be torn off. So this has to be avoided. He or she patient need to be turned to one side so that the froth that's coming out rolls out. It's not, you can't do anything. And don't rush with a spoon or a sharp instrument and put in the mouth. People have spoiled, injured patients like anything using those things. You should prevent patient from getting any injuries because of fit, like falling on the ground or falling from a car or falling from the roof or anywhere or falling on the street. And you come with a spoon trying to open a patient's mouth. Using the spoon, in fact, you can't open. You break teeth, you injure tongue, mouth, lips, everything. And there's bleeding and bleeding. So don't do it. Don't try to open the mouth. Even if the child has beaten or the patient has beaten his or her tongue, let it be like that. Okay? So this is to be done. And don't come with a bucket of water, a glass of water, and throw in the mouth of the patient, thinking that patient will become okay. Patient can aspirate that water, and that can go into the lung, and that can create a problem also. So try to clean nose and mouth using a dry handkerchief or anything like that, whichever is available. And another thing people do without knowing is, people come with a shoe and put on the mouth of the patient, thinking that patient, this is a treatment for epilepsy. This is a wrong idea that's there in our general population. This spoils patient's sickness like anything. Should be avoided, and the area should be airy. Crowd should disperse, and the fit usually stops within few minutes, 1 minute, 2 minutes, like that, and then patient goes into a bit drowsy state or comatose state. That time patient, need to be taken to be a doctor, and usually we tell the patient to carry a identity card, carrying his sickness or her sickness and patient's doctor's phone number in the card. Patient should have a photograph over there, and it should be written in the card that what medicine he is or she is on. So people should find that out if it is there, and then necessary action can be taken. With that, I finish over here.
Start.
Epilepsy is a neurological problem. It's a kind of problem which is seen in many people. The prevalence is almost 5 per 1,000 population. So it's that prevalent, and the management depends on how we handle. Sorry, eradicating.
Start.
Epilepsy is a neurological problem. The problem is because of sudden abnormal electrical discharge from the brain, and that spreads throughout the whole body and leads to various kinds of expressions. Expressions, not only that a patient will have convulsions like this, patient can have many kinds of expressions. Electrical discharge leads to all our activities our emotions, our look, our doing something, everything. So a epileptic patient, because of abnormal electrical discharge, can start even suddenly vomiting, and suddenly patient will stop vomiting and say that he was sick and he did vomit and she doesn't know that she has vomited. Suddenly somebody starts laughing or shouting or running and then stops. Or even somebody during fit can keep running and running, or driving a car, doing nonsense works, and then suddenly stopping, and patient or the individual forgets what he or she has done during that time. That is epilepsy. We in our term call it complex partial seizure. So commonly general people know that somebody should suddenly have a fall on the ground, should throw fits, convulsions, should have froth in the mouth, should have some blood in the mouth, and that's it. It's not that. So if we classify epilepsy, we have almost 50 types of abnormal behaviors or movements like that. So that is epilepsy. And next, epilepsy is caused by our abnormal brain. So what are the types of epilepsies? What are the types of abnormal brains? That also one should know. We can have a normal brain without any structural defect, throwing epilepsies, throwing abnormal electrical connections. We call it idiopathic epilepsy. We can have abnormal brain or some problem in the brain which we can find in MRI or CT scan. Commonest thing we find nowadays are a spot in the brain, or a ring lesion in the brain, or some infection in the brain. What has happened is, some problem in the brain that leads to change in electrical activity of the brain can lead to abnormal throwing of electrical currents and leading to fits. So the area of my brain, if is affected, which is concerned with my right hand only, is affected, is having a say tuberculoma or a ring lesion or a worm in the brain, is throwing abnormal electrical current which is not spreading throughout the whole brain, only limited to that area, I can start having feet only on one hand. So this is focal epilepsy. But if that focus starts throwing abnormal electric current, and that spreads in the whole brain, and whole brain throws electrical activity, then I will throw fits like this and I'll have different kind of expressions. If that focus is there in the brain, in an area where my emotion is affected, I may start suddenly crying, I can have some abnormal feeling, that depends, So this is how this is happening. So a patient, not that the patient will have to have some ring lesion in the brain, a scar in the brain. Sometimes somebody had some injury to the brain, or say some street accident, or some operation in the brain, and there is a scar formation. And that scar, if we have a scar in the body because of, say, some ulcer in the past or some injury, that scar is usually silent. But in the brain, that scar can cause abnormal electrical discharge from that surroundings, and that can lead to abnormal epilepsies. This is very common, very common. And this need to be controlled. The treatment, when we think of, we need to investigate the patient, find the type of epilepsy, and then we try to investigate to find the cause of epilepsy. So when we treat, number one is the abnormal throwing should be, abnormal fits or abnormal behavior should stop. So we have anti-epileptics. There are various anti-epileptics. So we treat with that. And then we need treatment for the cause also. I'll give you one simple example. Somebody is having, say, malaria. What happens in malaria? Patient gets intermittent fever and chill and rigor. If somebody is getting fever because of malaria, you give treatment for malaria, but patient don't know that he has got malaria. He comes with fever. You don't treat only fever. Patient needs immediate suppression of his or her problem of fever with antipyretics, but patient needs also treatment for malaria. Similarly, a patient is having epilepsies is because of, say, some tuberculosis in the brain, or say a worm in the brain, or some other problems like some metabolic defects that lead to some abnormal electrical discharge from the brain. So first, doctor's duty is to stop the fits, control the epilepsies, and also along with that, he or she, means that doctor should treat the patient's primary problem like tuberculosis or whatever the underlying cause that is there in the brain. That's how it's treated. So patient needs thorough investigations, thorough examinations, and then treatment. And this treatment is a long process. So it's not like other diseases where we find some cause, the treatment becomes shorter. Even say if we get a case with a ring lesion in the brain, as soon as our repeat CT scan or MRI scan shows that it has disappeared within 6 months, we can try to withdraw the medicines for epilepsy. But it may not be there all the time. We may have to continue treatment for a long time. So that is there. So that's treatment of epilepsy. And another area of treatment of epilepsy is if these are not controlled with medicines, at times operations are suggested. But operation may not be also effective because it's very difficult to find out the exact area of brain which is affected. And if say some important area is throwing epilepsies, and if neurosurgeon goes and takes out that area of brain, patient will have lots of problems. So there are limitations for operations also. And now I'll tell you one thing, how vast is the problem of epilepsy. I said we have 5 per 1,000 population. So 1 lakh population will have how many thousand epileptics? Your city have got how many? What is the population? So you can assess and say what is the patient load on your society. So that's the problem for us, for doctors, for the government, because this is a load for our health service. Okay.
Continue. So 1 minute. Start.
So nothing to be worried about. Epilepsy is like a simple disease. Somebody is having cough, fever. It's simple like that only, with a little difference. So one should not be panicky since he is having epilepsy or she is having epilepsy, or his or her family member is having epilepsies. Epilepsy is like that, with a little difference that treatment is a little long, and patient should take care of his or her taking medicine in right time and for right duration. So it's going to be cured and cured. Everybody should be fear-free on this angle. And if there are any questions, one can search in the net. We have many websites made, epilepsy for general population websites, internationally also made. We have International Epilepsy Society that's doing a lots of work for you people. And medicines, not that you think that are very expensive, there are very cheap medicines also, and there are very expensive medicines also. Tell your doctor if there is a problem because of expenses to choose a medicine from the cheaper side so that you don't find problem in continuing treatment. If the treatment is not available from government hospital, you can manage because there are very cheap medicines also with that. Thank you.